UroPatient. Tune in and see. Prepare your health for you and me. Knowledge is power. We make it clear every Saturday morning.
Hey, good morning and welcome to the UroPatient podcast. I'm your host, Vic Senese. Be sure to like and subscribe. Hey, if you or a loved one is preparing for a bladder removal surgery, also known as a radical cystectomy, you probably have a lot of questions. What should you expect after surgery? How long is the recovery? How will you manage your urinary diversion? And most importantly, can you still enjoy a full and active life? Today's episode, Bladder Removal Surgery, Life After Surgery Guide, I'll answer those questions and many more. So let's get started with your guide to life and bladder after bladder removal surgery. Let's take it away. If you recently had bladder surgery and you now have an ileal conduit, you're probably feeling excited just to be home, but maybe a little overwhelmed too. That's completely normal. In this guide, I'm going to walk you through what to expect during recovery, how to care for your stoma, how to manage your pouch, and more importantly, when to call your healthcare team. By the end, you're going to have confidence to care for your new urinary diversion one step at a time. Now, recovery happens gradually. During the first week, your focus is going to be totally on healing and learning basic pouch care. Over the next few weeks, you'll become more comfortable changing your own appliance and getting back to everyday activities. Now, about 3 months later, many people have returned to most things they enjoyed before surgery. Remember, everyone's recovery is going to be different, so don't compare yourself to others. Now let's take a look at what changed during surgery. Your bladder was removed, and a small piece of your intestine was used to create a new pathway for urine. That pathway ends in what's called a stoma, which is the opening on your abdomen. Since the stoma has no muscles to control urine flow, urine drains continuously into your pouch. This is completely normal, how it should work. When you first see your stoma, it may look swollen, moist, and bright red or pink. That's usual after surgery. As the weeks go by, the swelling goes down and the stoma becomes smaller. A healthy stoma should stay moist and pink or red. If it becomes dark purple, black, or pale, contact your healthcare provider right away. Now, recovery occurs in stages. During the first couple weeks, focus on resting, walking several times a day, important, and staying hydrated. Between weeks 2 to 6, you'll gradually increase your activity, but avoid heavy lifting. You got to heal inside. By week 6 through 12, many people are back to work, exercise, normal daily routines. Of course, make sure you have your healthcare provider's approval for all that. Now, your body needs good nutrition to heal. People forget about how important that is. Drink plenty of water unless your provider tells you there's a healthcare reason you can't. Eating smaller meals throughout the day may be easier at first. As your appetite returns, slowly add more foods back to your diet. Again, staying hydrated also helps reduce mucus buildup and keeps urine flowing freely through your pouch. Remember that stoma was created from bowel, which secretes mucus, so you're going to have to get used to that. Your pouching system has several parts working together. The skin barrier, also called the flange, protects your skin and sticks to your abdomen. The pouch collects urine throughout the day. Some systems come as one piece, while others have separate parts that connect together. Work with your ostomy nurse. That's the person who's most important. They're going to help you choose the system that works best for you, because everybody's abdomen is a little different. It's best to empty your pouch when it's about 1/3 to 1/2 full. This helps prevent pulling on the skin and helps avoid leaks. Remember, that weight of the urine is going to be pulling. Sit on the toilet or stand if that's more comfortable. Open the drain valve on the bottom of the pouch and empty the urine. Wipe the end clean, secure it closed, securely close the drain, and then you're finished. Pretty simple. When it's time to change your appliance, remove it gently. Support your skin with one hand while slowly peel, like a band-aid. You don't just rip it off. Slowly peel the barrier away with the other. If adhesive remover is recommended, use it to make removal easier. Never pull the appliance off quickly, like I said, like a band-aid. This can damage the skin around your stoma. And that's really important. You have to keep that skin healthy. During the first several weeks after surgery, your stoma will continue to shrink. That's normal. That's why it's important to measure it each time you change your appliance. The opening in the skin barrier should fit closely around the stoma, about 1/8 of an inch or roughly 3 millimeters. A good fit protects your skin from urine. Remember, urine isn't the best thing on your skin. Think about babies getting, diaper rash. Before applying a new pouch, clean the skin gently with warm water and dry it completely. This is one of the things I've, working with patients, have found. They get too quick on trying to put that pouch on. Of course, it's constantly having urine come out of it, so they get worried about that. But you can put a little a little cloth there to kind of suck up that urine, a 4x4, and let it dry completely. That's really important. Then you want to make sure you cut the opening to the correct size. As I remember, I told you, you want to be a little bit away from the stoma, like 3 millimeters. Center the barrier over the stoma and press it firmly around the edges. Now, hold your hand over the barrier for about a minute. Another step I see people get a little short on. They stick it and they think it's ready to just pop the bag on. No, you have to hold it for about a minute. Your body heat is what helps create a stronger seal. If you get a good seal, this thing is going to be flawless. That's the whole key. Having an ileal conduit shouldn't stop you from enjoying life. Most people return to work, travel, exercise, and spend time with friends and family. It may take a little planning at first, but before long, caring for your pouch becomes just another part of your daily routine. Hey, did you know that these really don't stink? Key fact. Knowing when to ask for help is even more important. Call your healthcare provider if you have a fever, severe abdominal pain, little or no urine draining into your pouch, persistent leaks that won't stop, worsening skin irritation, or if your stoma changes colors. It's always better to call with questions than to wait. All right, so here's a huge hint. Always keep extra ostomy supplies at home and when you travel. You don't want to find out you got your last pouch and the store's closed, right? Store them in a cool, dry place. Used pouches and barriers can usually be wrapped in a plastic bag and placed in your regular household trash. Never flush ostomy supplies down the toilet. They'll block it. Learning to live with an ileal conduit takes time, but you don't have to do it alone. Your surgeon, ostomy nurse, and healthcare team are here to support you. There are also excellent patient support groups where you can connect with others who have gone through the same experience. With practice, confidence grows, and most people return to living a full, active life. Well, I hope you found that helpful, because if you're going through surgery to have your bladder removed, you've got a lot of changes to go through. It's a tough one. Probably one of the bigger surgeries that we tend to do for patients. But on the other side, it's been a lifesaver for a lot of patients that would have otherwise died of their bladder cancer. So lots of choices. Now, this week, I really kind of covered what we call the ostomy stoma bag type catheter, the ileal conduit. But there's new changes where you can have like almost a new bladder. And I'm going to talk to you about that. Here's a little promo for that for next week.
Happens when someone needs their bladder removed. Is it possible to urinate normally again? In this episode of UroPatient, host Vic Senese explains what a neobladder is, how it is created, and what patients need to know about life after bladder removal surgery. Join us on August 1st at 10:30 a.m. Central Time to learn more.
All right, so there you go. The urologist that I worked for, he's retired now. He was one of the first to do it here in America. He actually had to travel to where they learned the technique and how to construct that bladder out of bowel. So join us next week to learn more about another option that you may want to discuss with your physician. Now, there's benefits, pros and cons to both, so you kind of have to decide what you think is going to work best for you. But there are options to kind of come with, sort of an artificial bladder. So always, every week, tune in to UroPatient Podcast, your best place to learn more about what's going on with you and your urology health. We'll see everybody next week. Have a great
From research updates to daily advice, Vic explains it all simple and precise. No question too small, no topic too wide. We're your urology partner, right by your side. UroPatient, tune in and see, baby, your health for you and me. Knowledge is power, we make it clear. Every Saturday morning, the podcast is here.